Good morning, everyone. Thanks for attending the webinar. Ben Gilman is going to get us started.
Thanks, Angie. Good morning, everyone. My name is Ben Gilman, and I am General Counsel for the Maine State Chamber of Commerce. And thank you for joining this morning on our webinar presentation in partnership with the Maine Department of Health and Human Services on an age-friendly Maine. Maine was designated as an age-friendly state in 2019, joining many cities and communities across the globe who are committed to becoming more inclusive of people of all ages. As part of this designation, Maine created an age-friendly state plan to highlight many organizations doing age-friendly work and to outline specific goals to guide Maine's age-friendly efforts moving forward. This presentation will provide an overview of Maine's age-friendly state plan and present the ways that businesses can support age-friendly work. We're looking forward to this presentation. All of our webinars are made possible through our sponsorship opportunities. We are partnering this morning with the Maine Department of Health and Human Services. Our other sponsors are AARP Maine, AmeriHealth Caritas, Bangor Savings Bank, Central Maine Power, Eaton Peabody, Attorneys at Laws, Mimic, which is the Maine Employees Mutual Insurance Company, and Rudman and Winchell. There are a couple ground rules this morning, just so everyone knows. You come in on mute. This meeting is being recorded, and we do make this recording available to the public to reduce background noise. Like I said, everyone's on listen only. If you have any questions, please type them into the chat room. We're happy to get to them at the end of the presentation here this morning. And if you have a question you want to ask in person, feel free to raise your hand and we can unmute you at that point as well. So joining us this morning from the Department of Health and Human Services to do the presentation is James Moorhead. James is the Aging Services Manager of the Office of Aging and Disability Services at the Maine Department of Health and Human Services. James, thank you very much for joining us this morning and this presentation that we're all looking forward to. And I'll hand it off to you. Thank you.
Thank you so much, Ben. And one moment while I share my screen. Okay. So thank you so much, Ben, and thank you to Maine Chamber of Commerce for inviting us here today to present on our efforts to create a more age-friendly state. I would also like to recognize those in attendance that are a part of this. Pat Catino from AARP is here, as well as Denise Lord, who's also part of this as well, which we'll get into. So what does it mean to be an age-friendly state? Through the World Health Organization, and I should probably advance the slide. Through the World Health Organization and AARP's network of age-friendly communities, there are domains of a livable community that focus on a variety of issues that make a community a great place to age in place. And we're going to touch on those domains and how it relates here in Maine a little bit later in the presentation. But I want to get to how we got to where we are today. As Ben mentioned, in 2019, Maine was designated as an age-friendly state. We are now one of 6 in the nation, so a good few select. We're leading the way on that. And this was also an effort to recognize the many, many age-friendly communities and also age-friendly initiatives that are done across the entire state of Maine at the community level. And so now we're part of this network through AARP. And one of the key parts of this plan is one of the first steps in a very multi-year long-term process, recognizing that the initiatives that we're trying to implement as part of this age-friendly state plan are not going to happen overnight. It's going to take many years and many people involved and to get to where we want to be. And again, the plan is there to encourage and implement the strategies that help best fit based on what Maine is and where we want to go. The Office of Aging and Disability Services, often called OAS, the office is the age-friendly lead. And to form our age-friendly state plan, we brought together 6 state agencies which are listed on this slide. And that was one of the key components that we wanted to implement in part of our state plan, is breaking down the silos between the departments at the state level, because aging it touches all of these. It touches transportation, it touches labor, it touches housing, it touches health, it touches economic development. You name whatever department that's in state government, there should be an aging focus, because again, Maine is one of the oldest states in the nation by median age. Also, Maine is one of the most rural states in New England. It is the most rural state in New England. In fact, we have the largest unorganized territory or frontier space east of the Mississippi. So Maine is very rural, and we also have an older population. So this is very vital work that that needs to happen at the state level. Those 6 agencies came together to form the Age-Friendly Steering Committee. In addition to the steering committee, we brought together an advisory committee that included a stakeholder group of over 50 organizations and individuals statewide. Anything from the Bike Coalition to trying to think of others that are not local municipalities, other interested, like the Maine Municipality Association, various groups across the state that are interested in this work. Because what we also found as part of our listening sessions in 2019 is that older adults go to local trusted sources of information before they contact the area agencies on aging or the state, any of the departments. They often go to their town offices or their town library. So it's really important to understand how older adults get their information and what an age-friendly community looks like at the local level. The plan was released in January of 2021, so what, 5 months ago, hot off the press. Governor Mills issued a press release in January, and like I said, here's a quote from one of her from that press release. Next, I would like to go review the domains that are listed in the state plan. And Joe, if you could you provide a link to a copy of the state plan that's on our website? So if you go to the Office of Aging and Disability Services website, a copy of the full plan is on our website. It is rightfully so a quite lengthy report. So I highly encourage you to download it and review it. But today I'm going to go briefly over the domains, the subdomains, and provide some example strategic objectives that relate to those subdomains. Again, this is not a comprehensive list of the objectives listed in the state plan, but we just wanted to illustrate how the plan is structured and what type of work we're really focusing on. We start off the first domain with respect, equity, and social engagement. We understand that the aging experience is influenced by multiple social identities and how they intersect. And understanding that race, socioeconomic status, ethnicity, gender identity, sexual orientation, all of these various factors that compromise our identities influence how individuals experience aging and also experience aging in their community. So we first and foremost start off with that an age-friendly community needs to be respectful of not only age, but also all of the other social identities that we have, and how does that influence it? One of the large tenets of the age-friendly initiative is combating ageism. And again, our experiences of ageism are influenced by those other social factors. So how does ageism influence the policies that are written at the state level? How does ageism influence the policies that are written at the local and county level? So it's really looking at how do we expand those opportunities for diversity and inclusion, including enhancing efforts to preserve and support autonomy. And one of the example objectives is raise awareness of and combat ageism. And by supporting current and emerging best practices in inclusion through cultural empathy, communication about reducing systematic biases and implicit biases, things like that. Also, part of this domain is social engagement and recognizing that how older adults and also individuals of any age interact with their community. How do they get involved? How do they become that volunteer and have those social connections as well? After the respect, equity, and social inclusion, we have accessible communication and information. As I mentioned earlier, one of the resounding themes that we learned is that older adults trust, and people in Maine trust local sources of information. We also recognize that how people access information is also influenced by issues such as broadband, right? So broadband is an aging issue, and how individuals access needed services and programs, how they get access to if they need access to a local food pantry, how do they get that information? And to that, we want to strengthen and bolster our no wrong door approach to accessing services. Our area agencies on aging, I'm not trying to use acronyms, so that's why I'm pausing. I'm trying not to use acronyms here. Our area agencies on aging are also our aging and disability resource connections. And they really are that first contact. They're not a one-stop shop, but they will point you in the direction that you need to go. And they know best what available resources are at the community level. So we really encourage individuals to contact their aging and disability resource connection when they need help, or they just need as simple as a phone number to a local plumber. I mean, it can be as simple as that. Trying to remember if I skipped anything. I mentioned town halls and all that. And I totally forgot the introductions of Joe and Hillary. Oops. Joe Zamboni is our policy and program development manager, and Hillary is our policy analysis and writer. They have been instrumental in leading this age-friendly initiative. They're the glue that's been keeping this thing moving forward. So I definitely want to recognize that. And also say, Joe, if there's anything I'm missing, please feel free to interrupt me.
Haven't noticed anything yet.
Okay, good. Another key, these are all key domains. And one of the points I want to get to across is that we can't talk about one domain without talking about all the other domains. We can't talk about access to health coverage and healthcare and supportive services without talking about how we access information, without talking about diversity, equity, and inclusion, without talking about transportation and housing, which we're going to go on later. So I think one of the really key components of this is while we're going over these domains individually, it is especially important that we remember that these overlap and intersect. And we can't talk about one without often talking about the others. With healthcare coverage, healthcare, healthy aging, and supportive services, this is all about, again, do people have access, and are those services and supports in the community available to them? We need to protect the access to healthcare. by implementing provisions of the Made for Maine Healthcare Coverage Act to promote affordable healthcare coverage for all Mainers, including older adults. Another strategy is to promote access to and coordinate community-based supportive services with healthcare services. So how do individuals who are admitted, discharged, or transferred between the hospital or long-term care facilities back into the community, do they have those services and supports that they need to be healthy and remain safe? And also promote healthy aging. This is a really, to me, a really key subdomain in that not all aging experiences are negative. There are beautiful aspects of aging, and that includes being a part of your community through volunteerism. That includes being a valuable part of the community leadership, whether that's being on town councils, committees, things like that. But also recognizing that there are ways to promote healthy aging in terms of mind and body. And then how do we practice mindfulness and brain health in terms of screening for Alzheimer's and dementia? We need earlier detection around that, as well as expanding those opportunities to participate in evidence-based programs like Tai Chi for arthritis, matter of balance, chronic disease self-management. So again, there are ways to promote healthy aging that is not all deficit focused. I think that's really important. Another domain as part of Maine's age-friendly state plan is employment and financial security. We recognize that economic security as we age, it becomes, I don't want to say tricky, but there's some planning that we can do early on as we're young. And that's, as a gerontologist, that's one of my key platforms, is that what we do now as younger adults influences how we age and what our experiences are later on in life. And that is especially important around financial planning. Are we building, do we have those mechanisms in the community that individuals can save and build that support? But also looking at the aging workforce in itself. So as long as our population continues to age, so is the workforce. And how do we look at opportunities to help older aging individuals to continue their participation in the workforce? Maybe that's through education about education of employers about older adults, the values of older adult workers, as well as looking at flexible work arrangements. It's not always that 9 to 5, 40 hours a week that individuals are looking for. So how do we create those job opportunities that accommodate that? As part of the enhanced access to financial information and tools and resources, there are efforts at the state level to create these, Joe, what are they called? They're the saving accounts. There are initiatives to create specialist saving accounts for long-term care at the state level. So again, what the point of this age-friendly plan is to lean on the work that is already being done at the state and local levels and pull those in and help to keep track of that as well. Another key part of income security are programs like the Senior Community Service Employment Program, which helps older individuals 55 plus who are low income and unemployed with job training and community service assignments to help build those skills and so that they can find gainful employment. And also another domain is to protect older Mainers' income security. Again, this is around that savings, but also recognizing that the cost of care is really, really high. So again, this is where you can see the domain of healthcare access and coverage really overlap with employment and financial security. Housing is another key domain. And again, housing is one of those, you can't talk about housing without talking about transportation, because where we choose to live and how we navigate our communities is influenced. So housing is also talking about the physical built house itself. Is it a safe aging in place opportunity for that individual? So how do we strengthen resources such as weatherization programs, home modification programs? Maybe that person needs a ramp built because now they use a walker or cane or a chair, widening the doorways, installing grab bars. So how do we make sure that where people are currently living is age friendly, but also housing exists within a context called the community. So where we choose to live is influenced by the community, the surrounding community, which again goes back to that respect, inclusion, and forgetting the respect domain of, is this a welcoming community of older adults? You know, do the parks have paved paths, which we're going to get to. Again, that's another domain around the built and the outdoor environment. I think I've approached that. Yeah. So that's housing. Transportation is key to, we know that public transportation is sparse across the entire state, and oftentimes individuals, regardless of their age, have to travel great distances to even access care. It's not uncommon that a person has to drive 45 minutes to an hour one way to go to a doctor's or a medical appointment. So how do we look at supporting access to transportation through things like our community action programs, our regional transportation partners like ART, the Aroostook Regional Transportation System, really looking at what's available and helping to support that. And also, how do we increase our volunteer drivers? How do we create volunteer opportunities through the local age-friendly communities to provide those transportation services to individuals, again, regardless of age? That again, a really key piece here is not just older adults that need access to transportation, it's also middle-aged individuals and younger individuals. In our listening sessions in 2019 across the state, another resounding factor was Mainers love the outdoors. Maine is an outdoor state, which means we want to live near good hiking trails. We want to live near good parks. We want to live near the like nature preserves to go bird watching. We like to go skiing. We like to go ATV riding across this. There are many ATV trails across the state. So how do we make sure that those outdoor opportunities are age friendly? One of the key pieces is promoting accessibility of these outdoor recreation areas. I know the National Parks Agency is really looking at this for national parks. So how do we do this for our state parks, our local parks, making sure that they're paved even paths for individuals who use a chair, making sure that there's braille and other communication pieces at placards that are posted. Even looking at virtual tours for individuals that may not be able to go on that hike, but still want to see the nature and the beauty of the state. So things like that. Also looking at the safety and succession planning for farmers and woodland owners. How do we protect those outdoor spaces so that they remain at those quality outdoor spaces? One of the things our partners in the advisory council is really concerned about farm succession. What's happening is these farmers don't have a successor to keep farming because we need access to good quality food, which is again tied to health. And what happens is these farms are sold and broken up into subdivisions. So again, how do we look at this both at the state and local level to protect those very valuable spaces? So those are the 7 domains of the age-friendly plan. Again, I highly encourage individuals to go download the plan and look through it. There's many more hidden gems in this that we do not have time to cover today, and more detail that we don't have time. We would be here pretty much all day. So one of the things we want to provide here is, what can you do about this? First and foremost, share the plan with organizations that you belong to. Looking at these domains and, okay, if you're an organization that does X, Y, Z, how do these domains apply to the work that you're doing? Is there something that you could adapt to be more age-friendly within your own organization's policies and programs? Again, one of the key ways is to choose one or more domains that you would like to work on. If you do want to initiate this age-friendly work, don't feel like you need to tackle all 7 at the same time. And again, that goes back to, if you're addressing transportation, naturally you're going to be touching other related domains. So choose one and focus on that. Create a local project or initiative that advances one or more. We know that as state government departments and agencies, there's so much that we can do, and there's a limit to that, and that there's going to be opportunities for individuals at the local level to carry this forward and really implement it at the community level. So we want to acknowledge that there is a natural gap between state level policies and what's happening at the local community level. Don't feel like you have to wait on the state policies to be developed and implemented for you to do something. So if you're really interested, do something. And also reach out to us. Joe's email is provided here on these slides. If you're interested in tackling one of the domains and you're looking at how your community or the programs you work on could be more inclusive and where they fit on, reach out to us, and we're more than happy to provide that technical assistance. What is going next? What's the future for the age-friendly state plan look like? Right now, we are doing community awareness sessions just like this one, where we're looking for any and all opportunities to speak at local community organizations or coalitions, or, you know, like the Maine Chamber of Commerce today is an excellent one. So if you know of a group that you think would be really benefit from hearing this, invite us, reach out to Joe and say, hey, we have this meeting in 2 months or next week or whatever. Do you have someone available to come speak about the age-friendly plan? We welcome that. Hopefully by the end of this year, fingers crossed, we are looking to implement a dashboard to start pulling on all of the good work that's already happening. So it's more of a local spot that individuals can look at, measuring against, okay, this was our objective. How well are we doing against this? And also more of a collection of what's currently being done. Do you know that the Department of Transportation has this program that's specifically aging friendly? We're looking to implement that within the next year. And we're also going to continue to host periodic steering committee meetings as well as advisory group meetings. We're trying at least on a quarterly basis to have those, or semi-annual, but we want this work to continue. the work is not done by any means. This was really one of the first steps. It was publishing the plan. Now the hard work begins to make sure that we are accomplishing what we set out to accomplish. Again, I want to acknowledge AARP Maine. They were a huge leader in this, and also Public Allies. Public Allies was very, very gracious to lend us to interns, community justice placements that were here for 10 months, and as well as COVID-19 core positions for two positions for 8 weeks. These individuals who were actually across the country, they weren't only in Maine. We had one in Baltimore, Detroit, so all over the country. We could have not have done this work without them. So we have to acknowledge them. And so want to learn more? Here is a link to the state plan, which I'm sure Joe shared in the chat as well. Again, here's the link. We really want to make sure people know where to find this. And with that, we are done. So now we would like to open it up to, does anyone have any questions for us? Yes. Sorry, your name's not displayed. National Saving Fatherhood. I'm sorry, I don't know your name. Hold on. I think we have to unmute you.
I think I just asked him to unmute.
Okay.
Did it work? Yeah, go ahead.
No, we don't hear you yet.
Everybody hear me now?
Yes. Hi.
Okay. All right. Hi, everybody. My name is Brother Alfred. I am the CEO for the National Saving Fatherhood Foundation here in Sanford, Maine. This is our headquarters, but we're a national program. But what I wanted to see if we can integrate what we are doing for fathers and families to try to interject that into what we are doing. Now, we have our core program. Of course, people that may or may not know on here about us that, we're the only fatherhood program in the whole United States that offers child support payments program. That means if a father can't make his child support payment, we will go and help him along that until he gets his finances back and stable. What I would like to try to do is, seeing that we are basically new to the nonprofit organization area, but we also are starting to build our name up a little bit. We can probably find a way, if we can work together with anybody. We're willing to work with anybody to see if we can integrate with our systems and with this kind of program, because I'm seeing in my community, also as a Black man, I'm seeing my community grow. When I first came to Maine, I think it was 2016, 2017, and I was like a black dot on a white piece of paper. You might as well just be real with what it was. And but now it's like you see more and more community. Before, you thought it was just the Somali community coming here, but now it's everywhere. So, whether it's in Alfred, Maine, or is Sanford, Maine, or Saco, or whatever, vice versa, the community is growing. It's because, I guess you can say one of it is because of the George Floyd thing, and I did like a big thing, and I have a big following on TikTok, and I told everybody, listen, you don't have to worry about what's going out there here in Maine, because, quote, the police department, we don't have time for that kind of stuff. So, I think it resonated with certain people, and they started moving towards Maine. So with that growing, and we're also trying to tackle the homelessness issue. We're trying to a father not being in the home issue, and so forth. my question is there any way you could think of, or anybody can think of, that we can work together, or that, try to put some of these 7 pillars here into our programs? If someone could just, I did put the link in the chat of our website, so everybody can just check it out, and just, if you want to hit me with an answer, I appreciate that way as well. And let me know where we can work together to try to interject that as well. We're still working, trying to get into core systems and stuff like that. So, but that's going to, of course, take time. But in the meanwhile, I'm willing to work with the cities and states and other organizations and other programs and businesses to try to make take us to the next step to help in Maine become a prominent age-friendly support issue. Okay, so I guess that's my question right there.
Thank you. It's Albert, right?
Alfred. Like the
Alfred.
town.
Alfred. Okay. Nice to meet you, Alfred.
Mhm.
Yeah, that's great. I'm thinking, please reach out to us and let's talk more in depth. Because I don't think we're gonna solve it today. But please reach out. And Joe provided his email address, because I'm sure the people that you help are not all younger. Right? So especially when you do have, sorry, I have an aging lens, so that is one of my biases here. So when you do have those individuals, making sure that they have information available about local resources and programs, I think that's going to be very, very vital in developing those, like a resource list. If you're an older person that you're helping, hey, here's some aging and disability resources in the community, and making sure that they're aware of what is actually available, because oftentimes we're the worst kept, we're the worst kept secret. We need to get the word out about what is available. So that's what comes off immediately off my head. But let's connect and form.
Yeah, because I really think the other thing is that what you just said to me resonated with me a lot too. So I think something like our Build Up program, where we have older fathers mentor young fathers, and I think something like that we can probably and let the mentor give that resource to the younger father. So I think I think fast. I'm a problem solver, so that's just my nature.
Yep.
So I think something like that would definitely work great with us, in that field, and anybody that wants to do that. Like I said, I'm going to try to write down all the emails I can and everything today. But but the best way is for me is anybody can reach out. As far as just go to the website and just contact me, and I will remember you. Trust me, and I will make sure that we can keep this going, because I think we can make Maine the place, not just a vacation state, but the state to be.
Yep. And so I moved from Atlanta, which is really diverse. And so moving to Maine, I was like, where, this is weird. What? So I get it. And it's good. I'm very, very glad to see that we are a place that people want to move to. And that's great to hear. So thank you.
Thank you.
Alfred, and we'll definitely be in touch. Pat.
Okay, I'm unmuted, I guess.
Yay.
Yay.
Hey, Pat.
Yes. So I just want to say a couple of things, which is everybody is aging.
Yep.
So again, I think looking at it from that lens is a great way to do that. And again, I am Alfred. I'm the volunteer state president for ARP Maine. And there's a lot of things that I think that we could work with you on. And again, and then integrate back in with the state plan. We have 71 age-friendly communities across the state. And so there's a lot that can be done. So I just wanted to say that, and your idea about the mentoring and the fathers of younger and older, it's a fabulous idea. It's worked extremely well in many other states. And again, it's a real key piece, I think, in terms of us helping to make our local communities more age friendly. And again, for all generations. The intergenerational stuff also benefits, you know, both the younger and older. So I'm very interested in hearing about your organization, and I will reach out.
Oh, James, I think you muted.
Great. This has been, yeah. Well, if anyone does have any additional questions, or please, Alfred, please reach out. And yeah, thank you for attending today. Again, if you're more interested, please, because I know other people may be listening to this after the fact. If you're interested in this work and you were not able to attend today, please reach out to this. It's not just excluded to, or it's not just for those who attended today. So please reach out, and we look forward to working with you.
And just in closing, thanks, James. That was a fantastic presentation. We really appreciate it. Thanks to everyone for joining today. This recording will be available on our website for others to view and request other presentations in the future. I'd like to just close up by thanking the partnership with DHHS and thanking our sponsors that made this possible. That's AARP Maine, AmeriHealth Caritas, Bangor Savings Bank, Central Maine Power, Eaton Peabody, Mimic, and Rudman and Winchell. So hope everyone has a wonderful day. Enjoy it and get outside a little bit today. Looks like it's a nice spring day out there. Thank you, everyone.